So let's discuss with the tear film, which is again the part of cornea and contact lens lecture series. So basically, why I'm doing tear film, because tear film cornea is directly the part of contact lens, and when you insert the contact lens, we are going to definitely make some changes with tear film, make some changes in cornea, make some changes in conjunctiva. So that's why making this video. And definitely whenever there is a severe case of dry eye, in that particular case contact lens, even scleral contact lens particularly, works as a therapeutic lens too. So let's the contact lens and tear film is closely related topic. So that's why I'm making one video with a tear film, and then I'll make another video on blinking, definitely, which is very important for the contact lens. So let's move further. So tear film is a layer of fluid on the surface of cornea and conjunctiva too. So first demonstrated by the Fisher in 1928 by using reflectography, and it's also called by Wolf is precorneal film 1946, and it's trilaminar structures. Yes, sometimes trilaminar, sometimes nowadays it's called I don't know, lipid layer, and then trilaminar means lipid layer, aqueous layer, and then mucin layer. But nowadays it's called mucin and aqueous. It's called, what do you call that, mixed concept, but we will definitely deal with it. So what do you mean by that? Composition of tear film is composed of three layers: so outer superficial lipid layer, middle aqueous layer, and the inner mucin layer. But this picture I have taken from this book, Ocular Surface Diseases in on certain book. So one concept is this, like this is lipid, and this is aqueous, and this is mucin layer. The another concept is this is lipid layer, and then the second layer is basically mucin and aqueous mixed layer. But as you move towards the lipid layer, the concentration of aqueous is high. As you move towards the corneal surface, basically epithelium, the mucin concentration is high. So that's the concept. But basically, yes, it's for today we can take it as a three layer. Okay, just move forward. So lipid layer. What is lipid layer? It's basically secreted from mammalian gland, gland of Zeech, and gland of Moore. And primary constitute is hydrocarbons, fatty acid, sterol esters, wax esters, and triglycerides. Isn't it? Lipid layer. What is the function of lipid layer? So I will going to talk about the function in last slides too, because at that last slide we're going to definitely talk about functions in 3 to 4 slides or 5 slides. But let's move with the each layer functions. So main function of the lipid is to retard the evaporation of aqueous layer. That's the main function, isn't it? In contribution of optical property of the film, because the first light interact with eye is definitely at lipid layer. So maintain the hydrophobic barrier that prevents the over. Basically, lipid layer maintains the hydrophobic barrier that prevents overflow by increasing surface tension. So basically, lipid layer also helps to increase surface tension. That's why tear do not get overflow. So it prevents the damage of the lid margin skin by tears, skin lipid contamination. So it basically prevent the contamination of skin lipids with the tears, isn't it? So second layer is definitely aqueous layer. Aqueous layer is secreted by the lacrimal gland, accessory lacrimal gland, that of two, which is accessory lacrimal gland of Cross and accessory lacrimal gland of warfarin. So primary constitute is definitely water, aqueous means water, inorganic electrolytes, organic substitute of low and high concentration molecular weight like urea, glucose, lactate, citrate, absorbent, and amino acids. And what is the functions of aqueous layer? Supplied oxygen to the avascular corneal epithelium. Best thing, isn't it? It supplies oxygen means what? Atmospheric oxygen dissolve with the aqueous layer of tear, isn't it? Yes. And that dissolved oxygen is definitely supplied to corneal epithelium. Yes, that's the concept. So antimicrobial activity, basically lysosome and lactoferrin and immunoglobulins IgG, IgM, IgD, IgE, and IgA. Yes, IgA. And antiviral interferons are also there, which act as a defense mechanism. We'll definitely talk about it in function section. So wash away the debris, cleaning function is also done. Maintain constant electrolyte composition over the ocular surface epithelium. So smooth minute irregularities of the anterior corneal surface is basically done by aqueous layer. That's why it makes surface optically smoother. And bicarbonate regulates the pH of the tear, isn't it? So mucus layer, third layer, deepest structure of the film and covers the microplica of the superficial epithelium and forms a fine network over the conjunctival surface. Basically, uh, mucin is covered over the microplica. That's why mucin layer makes actually it attached to the cornea, yeah, isn't it? Contain mucin, protein, and electrolytes in water. Tear meniscus are secreted principally by conjunctival globule cells. That's very important. Whenever anything happens with the conjunctival globule cells, mucin layer destroyed. For example, a very good example of viral conjunctivitis. Another example, vitamin D deficiency. It's common. Another example, chemical injury, which is a common clinical condition you will face in your life. That because of this condition, global cell number reduces. Because of this, mucin layer hampered, and because of that, dry eye is there. So the stratified squamous cells of the conjunctiva and corneal epithelium and minimum lacrimal gland, minimum secreted by lacrimal gland and glands of Henle and Mars, but majority is secreted by conjunctival goblet cells. So what are the function? Basically converts corneal epithelium from hydrophobic to hydrophilic. So that's the layer. Mucin layer is credited for corneal epithelium. Cornea is basically hydrophobic, isn't it? So that's the layer which converts hydrophobic corneal epithelium to hydrophilic because mucus layer is adhere to the cornea. Okay, and with mucus layer, aqueous layer and lipid layer adheres. So the mucin also interacts with the tear lipid layer to lower surface tension, thereby stabilizing tear film. It provides the lubrication for the eye movement. That's good. It provides lubrication, and loose mucin network covers the bulbar conjunctiva, traps exploded surface cells, foreign body, and bacteria. Basically means uh, these things, bacteria, surface cells, these all trapped in the mucin, and then it excreted from the tear. So let's come to the dimensions. These dimensions are very common target in MCQ questions. Just remember these dimensions are very much helpful in MCQ question because it's very lovely MCQ questions are asked from the dimensions. Okay, I'll give rough idea, but I think the dimensions are definitely author by author differ and book by book we slightly can be differ. Just follow the best possible at your possible exposure. So as per I have made, its distribution of tear volume. Precorneal is 1 microliter, tear meniscus 3 microliter, cul-de-sac 4 microliter. In overall, it's like 7 microliter, isn't 7 to 8. So total thickness is 3 to 12 micrometer roughly. Lipid layer is 40 to 150 nanometer. Aqueous layer 7 micrometer. Tear volume 6 to 6.5 to 8.5 microliter. Turnover rate, this is commonly asked in MCQ, 15 to 16% per minute. Tear meniscus volume, roughly this range. Osmolarity is commonly asked in MCQ question, commonly, very commonly asked in MCQ, very commonly in competitive exam. It's roughly take 300 roughly, but it's very important you get to know this number, milliosmol per liter. It's commonly asked in MCQ. And production rate is this, which is also commonly asked in MCQ, but these two are very commonly asked in MCQ. Okay, and evaporation rate, this is the evaporation rate. pH, yes, definitely you have to understand pH in, it's commonly asked in MCQ. Temperature, yes, corneal and conjunctiva are slightly differ. Conjunctiva slightly uh, warmer because there is a blood vessels. Where there is a blood vessels, temperature is definitely going slightly higher. So definitely tear temperature in cornea is more slightly cooler. Surface tension is this value, and lactoferrin level is this. Refractive index definitely this, and refractive index of epithelium is this 1.37 to 1.401, and refractive index of tear is this one. Okay, just remember these numbers, but you don't have to remember all the number, but there are some number which are very important as an MCQs. Okay, so what are the tear film dynamics? It's important, tear film dynamics. So basically secretion and are continually secreted by basis. The most important is accessory lacrimal gland. Whenever there is no reflex secretion, yes, reflex secretion mainly related to main lacrimal gland, but accessory lacrimal gland are basal secretion, which is gland of Wolverine and gland of Krauss. And the secretion Reflex secretion occur in response to sensation from the cornea and conjunctiva, isn't it? Somas 1 and Somas 2 difference. We will definitely talk about later on later videos. The efferent pathway of the secretion is formed by fifth nerve, isn't it? Efferent pathway, what pathway? Nerve takes information but different from cornea or conjunctiva, and the efferent pathway is parasympathetic supply to the lacrimal gland, isn't it? Parasympathetic supply. So turnover rate, complete turnover rate is roughly 5 to 7 minutes. This is also important in case of MCQs. So this is how the lacrimal gland and the excitatory duct here in this temporal superior temporal portion of the conjunctiva where all the echoes is definitely produced there, and from there blinking mechanism it takes. So I'm not going to talk about lacrimal apparatus and the structure and anatomy, definitely not. So distribution, well, distribution of the tear film is possible due to conjunctival mucus that makes cornea hydrophilic. What do you mean by that? Basically means distribution of the tear film is possible due to mucus is attached to the cornea. Yes, that's the concept. So interaction of eyelids and the tear in corneal wetting, basically blinking. Blinking is major important factor whenever we talk about distribution of the tear film. Okay, that's why I'm going to make one separate video on blinking itself. Okay, and when blinking is very important whenever we are going to fit the contact lens. Blinking is central important. So the sequence of events in formation of the precorneal tear film is lead spreads the cornea with the layer of mucus. On this, aqueous then spreads spontaneously because aqueous is basically on top of mucus, and then the superficial lipid layer spreads over it, retarding its evaporation, isn't it? First mucus attached to the cornea, then above aqueous layer, then definitely superficial lipid layer which retard the evaporation and enhance the stability. That's two, evaporation retarding and enhancing the stability. That's two things, two one of the two main important function of lipid layer, isn't it? Yes. Okay, then let's talk about what happens when we close our lid and then we open our lid, how that tear spreads and how that lipid monolayer forms bilayer or multilayer. Then it again when we open it forms monolayer. So that's a little bit whenever we close our eyes or totally close and open, what are the things that happen, what are the dynamics that happen there. Okay, as the upper lid moves downward, first it moved downward, the superficial layer is compressed. What is the superficial layer? Is definitely lipid layer. As it thickens, it begins to extend interference color, basically means in interferometry. The whole lipid layer together with the association of bipolars is compressed between the edges. Between the edge means between the edge of the lipid, isn't it? When we close, it's between the edge of the sorry, not lipid, between the edge of the lid, the lipid layer is compressed. So I think see in this picture, isn't it? Thick layer of lipid. So lipid contaminated mucus is rolled up in the thread-like shape and dragged into the lower fornix. So basically means the lower fornix here that happens. On opening of the eye, at first lipid spread in the form of monolayer. Basically means here lipid is compressed and bilayer or multiple layer is formed. Whenever we open our eye, the lipid is also lies on the top of the tear film and it opens and it spread and forms monocular layer against the upper eyelid, and then spreading lipid drags some aqueous tear within thereby and thickening the tear film. So basically means it drags lipid layer becomes monolayer and it drags some aqueous component, and that's what happened here whenever we trying to closing our eyes and then we close completely and when we reopen our eyes, how that lipid spreads. Okay, so the composition factors, as we know already, the so ocular surface epithelium basically means the goblet cells produce mucin, mammalian gland produce lipid, and lacrimal gland produce aqueous, isn't it? So hydrodynamics factors are eyelid blinking. Yes, it opens and spread and clearance. So eyelid close, avoid exposure. These are the things. So the composition factors are responsible for producing three major tear components are aqueous, lipid, and mucins. So hydrodynamic factor. What are the two factors? Isn't it? One is compositional factor, another is hydrodynamic factors. So hydrodynamic factor means the turnover, isn't it? Generate effective tear clearance, turnover, and the spread to cover the ocular surface and intermediate closure to avoid unwanted exposure and desiccations. These two factors are there. One is compositional factor, another is hydrodynamic factor. What are the two factors? So compositional factors, the seventh nerve parasympathetic, it supplies all like lacrimal gland, mammalian gland, goblet cells, and then what happens? They secretes aqueous, lipid, mucin, isn't it? And eventually they create stable tear film. At the same time, seventh nerve motor system, which is hydrodynamics, basically seventh nerve is basically in closing of the eyelid, isn't it? So lid blink and lid closer. What that does is actually, whenever we closed and we open the eye, it is spread and clearance there is also helping the stability of tear film, isn't it? So both things are compositional and dynamic factor. So we are definitely going to talk about more about that. What do you call it? It's closing and opening of eye and how that tear functions there and how dynamics change. So in blinking video, most probably. So, tear film is transient. Definitely, we know that after a finite period of the time, integrity of the tear structure is lost and leading to the tear film rupture. Isn't it what we call tear breakup? Isn't it? And the loss in so so tear film ruptures, the tear breakup. So one of the famous concept of tear breakup, how this happens is this is a normal state. So everything is good, isn't it? Here's the epithelium and the so basically villi and aqueous layer and mucin layer, and the superficial is lipid layer. So after some time diffusion is there, and then lipid get down to the mucin layer, and when it actually attached to the mucin layer villa, then tear breaks up. That's the concept. Okay, that's holy and lamp model of the tear breakup. That's the concept basically. So tear flow. What are the factors that play main role in the tear flow? So tear flow, there are three factors which is very important. Two is very gravity, yes, a little bit, but capillary action and the blinking. Blinking is elephant of the room. Okay. So tear flow, whenever it's lid close, what happens when we close our lid? So contraction of the orbicularis oculi muscles causes the lid closer with a scissor-like action towards the nose. Basically means that's very important whenever we fit contact lens. Eyelid closure always begins in the temporal side and moves in a nasal side. Okay, in a scissor-like fashion. So that's why whenever you see contact lens and the movement of the contact lens is always like a little bit. Basically that scissor-like movement does affect in the contact lens stability too. So lid closure propels the tears towards the middle canthus. So this is what I'm talking about. So drainage is tear is drained from the lacus lacrimalis in the nasolacrimal duct by the active pump mechanism. What is the active pump mechanism? Very simple. Operates during the blinking. So on closure of the eyelid, whenever we close the eyelid, what happens? So contraction of the pretarsal fibers of orbicularis compresses the ampulla and shortens the canaliculi. What happens whenever it shortens the canaliculi? This propels the tear present in the ampulla and horizontal part of the canaliculi towards the lacrimal sac. Why? Because whenever we close our eyes, that creates negative pressure in lacrimal sac, isn't it? So contraction of the preceptal fibers in lacrimal orbicularis pulls the lacrimal fascia and the lateral wall of the lacrimal sac laterally, and thereby opening normally closed lacrimal sac. So why producing a relatively negative pressure, and that because it produces negative pressure, it draws the tear from the canaliculi to the lacrimal sac, along with the increase in tension on the lacrimal fascia. The inferior portion closes more tightly and prevents the aspiration of air from the nose. Basically, there is a valve in the inferior part of the hair, inferior part of the nasolacrimal duct, isn't it? So, when eyelid opens, then what happens? When eyelid opens here, so relaxation of the pretarsal fibers of the orbicularis allows the canal cavity to expand and reopen, then draws the lacrimal fluid through the puncta from the lacrimal lake. So the relaxation of the portion preceptor allows the lacrimal sacs to collapse and then expel the fluid, thereby opening the nasolacrimal duct. So basically, uh, open condition, tear is here. Whenever I closed, then this sac creates negative pressure because of there is a lot of relationship between pretarsal fibers of ocularis, and then it opens because of negative pressure from tear from eye lead margin goes into the lacrimal sac. Whenever you open it, then tear goes down, isn't it? And from there, uh, it passes out. So basically, what are the functions of the tear? So tear functions of the tear film, we must be clear about it. So I take again few slides for to understand what are the functions of the tear film. Okay, so we have to understand clearly what are the functions of the tear film. It's very important in your examination and all of your life. So, optical function. What is the optical function? It creates a smooth refractive surface, the most critical function for vision. Because whenever, so you see in your life, you will see dry eyes patient will complain that this vision is blurred or there is refractive changes in spectacle power. But when you examine his or her spectacle power, the power is constant. Diagram test is good, but you come to know that it's problem of dry eye. Okay, it's always there. So tear film fills the microscopic irregularities of the surface of the cornea and creating perfectly smooth optical surface is very important, and this allows the light to enter the out without distortion, and which is essential for forming clear retinal image. It's very important that dry eye creates false impression of refractive error. Okay, so maintaining corneal hydration. A well hydrated cornea is essential for the transparency. So dehydration leads to corneal edema and swelling, cloudiness, or scattering of the light and blurs. So basically, for maintaining the corneal hydration, it's very important to have a literally good tear film. Okay, so mechanical and lubrication functions, it's definitely, isn't it? Lubrication function provide the lubrication between eyelid and the ocular surface cornea conjunctiva during blinking, allowing smoother frictionless movement and prevent mechanical damage, isn't it? It's very important. Whenever we are going to prescribe contact lens, we want pre contact lens tear film, because if there is a pre-contact lens tear film, the definitely lubrication is good, and there is less chance of getting upper lid papillary reactions. So protection from foreign bodies, isn't it? Basically, fluid layer helps to flush out the small dust particle, allergens, and other foreign materials from the eye surface through the constant flushing out through blinking and tear drainage. So that's why tear film also protects from the foreign bodies. And wound healing, the very important role of tear film in wound healing. So contains growth factor in tears and vitamin A that promotes the corneal epithelium healing after minor abrasion injuries. So another is antimicrobial or immunological defense. It's again central importance. See, tear has a component which also acts as antimicrobial and immunological defense, isn't it? First is physical barrier and dilution. What do you mean by that? The constant flow and production of tear let physically wash away pathogens. First, it washes away pathogens and prevent them from adhering to the ocular surface. It's very important. Bacteria, virus. Another is contains the antimicrobial agent. Tear are rich in powerful innate immunological components that destroys the pathogen. For example, lysozyme, isn't it? An enzyme that breaks. So basically, it breaks down the cell wall of gram-positive bacteria, and lactoferrin, it binds to the iron and starving bacteria for essential nutrients. Lipocarin, so basically secretory immunoglobulins, immunoglobulin A, for example. So these all things are doing work against the pathogens. And anti-inflammatory components are also there in tear, which contains regular regulator and help control the inflammatory response and prevent excessive damage so of the ocular surface tissues. So that's what antimicrobial and immunological defense system of tear film. So nutrition and metabolic function. Oh, that's very important, isn't it? Oxygen supply, it's crucial that avascular is basically cornea is avascular. Then corneal epithelium gets maximum oxygen from directly from tear, isn't it? So that's the problem with contact lens. When you put contact lens, if contact lens material is like, let's take a low oxygen permeable, then there is a huge chance of doing devastating results in long term, isn't it? So that's what we're talking about in our previous videos. So nutrition delivery, isn't delivery essential nutrition like glucose, electrolytes, and amino acids and to corneal epithelium? Yes, aqueous humor is also supply glucose, electrolyte, and amino acids to cornea, but the epithelium is uppermost. So that's why directly through the through the tear film it supplies. And the waste removal is crucial. Waste removal, I've already talked about it. So finally, the hydration and osmotic regulation, the prevention of desiccation. The primary role of the aqueous layer is to keep the ocular surface continuously moist and prevent dryness and damage of the epithelium cells. So that's what happened, isn't it? If we see dry eye patient, damage of the epithelium cell is common, and that's why there is a fluorescent staining and rose bangle staining there, isn't it? So maintaining osmolarity. So nowadays dry eye is defined with osmolarity too, isn't it? So the stable tear film has carefully regulated salt concentration. Osmolarity in dry eye disease, tear osmolarity increases, which itself becomes a source of damage and inflammation in the ocular surface. Nowadays we have a lot of papers on the tear film osmolarity, and a lot of new diagnostic tools which helps to examine dry eye with on the basis of osmolarity of the tear film, isn't it? That's why I've already told you approximately 300 millimole per liter is and rough idea for the normal tear osmolarity. The stake and this number is helpful in your MCQs. I have already told you, isn't it? Okay, that's it. So finally, these are my references. The same my references is very helpful to you and in future. I think this book is very good book that I have studied. So I think it's long video but worth it. That's all. Bistan, choose.